8 silent signs your arteries may be clogged. Most people think that a blocked artery always starts with chest pain, but the truth is, most of the time, it's much quieter than that. Inside your blood vessels, a process can move forward for years, without you feeling any pain at all, even while you believe you're completely healthy. The information shared in this video is for educational purposes only and is not a substitute for medical diagnosis or treatment. If you notice similar symptoms in yourself, consulting a healthcare professional is always the right step to take. Hardening of the arteries, known as atherosclerosis, is a long, slow process that happens when fat, cholesterol, and other substances build up on the inner walls of the arteries. Over the years, this buildup narrows the arteries and makes it harder for blood to flow through. Here's the interesting part. This process usually moves forward without any warning signs because the body can adapt to reduced blood flow for a while. But some subtle signals can be noticed if you pay close attention. One of the 8 signs we'll share in this video is something a lot of people blame on a completely different cause, when in fact, it may be directly connected to the arteries of the heart. We'll get to that one later in the video because it's often the last one people notice, but also the most striking. There's a reason for all of this. Arteries are designed with flexibility and a wide inner passage, so that under normal circumstances, they offer almost no resistance to blood flow. But over the years, layers of fat and deposits of calcium building up on the artery walls slowly narrow that wide passage. The body usually responds to this change with a surprising ability to adapt. Neighboring blood vessels step in to help, the heart works a little harder, and for a while, a person can go about their life without feeling a thing. The problem is that at some point, this adaptation mechanism starts to fall short, and that's exactly when the signs we're about to list can start to appear. Number 1, a feeling of pressure or heaviness in the chest. Even though pressure in the chest is the most well-known sign of a blocked artery, it's important to know that this feeling doesn't always show up as sharp pain. Some people describe it as if a stone were sitting on their chest, while others say they just feel a slight tightness or fullness. In medicine, this is called angina, and it can happen when the heart muscle isn't getting enough oxygen. This feeling often shows up while climbing stairs, walking briskly, or during a stressful moment, and it tends to go away with rest. Because of that, it's easy to dismiss since it's often not severe. The story of Robert, a 62-year-old teacher, is a good example of this. For months, he felt a slight tightness in his chest while working in his garden, but he chalked it up to being tired. Since the feeling would go away after he sat down and rested for a few minutes, he didn't take it seriously. It was only when his family insisted that he see a doctor that he learned this feeling might actually be related to blood flow to his heart. Stories like this show that the body doesn't always speak clearly, but it's still trying to say something. There are a few subtle features that set this kind of pressure apart from other common discomforts. For example, heartburn usually shows up after eating, while pressure related to the heart tends to appear during physical exertion or emotional stress and relatively quickly eases with rest. This feeling also doesn't always stay limited to the chest. It can spread toward the jaw, the left arm, or the upper back. Of course, this doesn't mean every chest discomfort is heart-related. Many different causes can create similar sensations. But when a repeating pressure that follows a certain pattern and is linked to physical effort is noticed, sharing it with a doctor can be an important first step. Number 2, shortness of breath. Suddenly feeling short of breath during everyday activities that never used to bother you is another quiet warning sign worth paying attention to. When blood flow to the heart decreases, the heart may not be able to pump enough blood to meet the body's needs, and this can lead to a kind of fullness in the lungs, causing shortness of breath. The tricky part about this symptom is that it's often dismissed as simply a sign of getting older or gaining weight. But suddenly finding yourself out of breath while climbing stairs or taking a light walk can be a sign that your body isn't functioning the way it normally does. This symptom sometimes doesn't show up alone. It can appear along with a mild feeling of fatigue. People often think, "I'm just not as fit as I used to be," and accept it as a natural part of aging. But when these kinds of changes suddenly become more noticeable or worsen significantly, it could be a signal of an underlying circulation problem. In these cases, an early evaluation can help prevent more serious problems down the road. One important thing to consider when evaluating shortness of breath is how quickly it develops. A mild shortness of breath that develops very slowly over the years can turn into something a person gets used to without even realizing it. But a shortness of breath that noticeably worsens over the course of just a few weeks or months can be a sign that the body is dealing with a more urgent problem adapting. Some people only notice this change when it starts limiting their daily routines. For example, when they find they now have to pause partway up a staircase they used to climb without any trouble. These kinds of small but consistent changes can carry important clues that shouldn't be ignored. Another factor that can make this symptom more complicated is how it can show up at night. Some people feel a slight tightness when lying flat in bed, and without really thinking about it, they start adding more pillows to feel comfortable. This can be the body's way of compensating for fluid buildup in the lungs, and it's often one of the hardest symptoms to notice, because a person might interpret it as simply looking for a more comfortable sleeping position. When a change like this happens, rather than treating it as a temporary discomfort, it's safer to bring it up with a healthcare professional. Number 3, pain or cramping in the legs while walking. Blocked arteries don't only affect the heart. A similar process can happen in arteries in other parts of the body. When arteries in the legs narrow, the muscles may not get enough blood, especially while walking, and this can lead to cramp-like pain in the calves, hips, or thighs. This condition is called Peripheral Artery Disease, and interestingly, when a person stops to rest, the pain usually eases within a few minutes. Because of this cyclical pattern, many people mistake it for ordinary muscle fatigue. Margaret, who is 70 years old, used to go for a walk with her dog every morning, and after a while she noticed she had to stop halfway through to rest. Since the pain in her calves went away after a few minutes, she considered it simple muscle tension. Months later, during a checkup, she learned that blood flow in her legs had decreased, and that this could be connected to hardening of the arteries. Cases like this show why it's important to be able to tell the difference between recurring pain that follows a certain pattern and ordinary fatigue. The clearest feature that sets this symptom apart from normal muscle soreness is the pattern in which it appears. Ordinary muscle fatigue usually develops after an unusual or intense amount of effort and fades on its own within a few days. Leg pain related to circulation, on the other hand, shows up every time a similar distance is walked, eases quickly with rest, and starts again once walking resumes. Some people adapt to this cycle without even realizing it, unconsciously shortening their walking distance or slowing their pace. This natural adaptation can cause the symptom to go unnoticed for a long time, which is why it's recommended that any recurring pain that appears while walking and eases with rest should definitely be shared with a healthcare professional. Number 4, persistent coldness or numbness in the hands and feet. If your hands or feet feel colder than other people's more often, or if you occasionally experience numbness, this could be a clue related to your circulatory system. When arteries narrow, the amount of blood reaching the extremities of the body, meaning the fingers and toes, can decrease. This can show up as coldness, paleness, or a slight tingling sensation in those areas. This is especially worth paying attention to if the symptom continues not just in cold weather, but even in warm environments. These kinds of symptoms usually develop slowly, so a person can get used to it over time and start to consider it normal. But when a part of the body is consistently unable to warm up properly, it can be a sign that blood flow to that area is limited. What matters here is being able to notice when the change started and how often it repeats. In some cases, this symptom can also appear along with small changes in skin color. For example, the toes or fingertips might appear noticeably paler or slightly bluish compared to the rest of the body. In addition, slower nail growth in these areas, or small cracks in the skin taking longer than normal to heal, can offer other clues that blood flow to that area may be limited. These symptoms are rarely concerning on their own, but when several appear together, it can be helpful to get a more thorough evaluation of the circulatory system. The 4 symptoms we've covered so far were mostly changes felt in the outer parts of the body, in the arms and legs. But next is a symptom related to a completely different area, one that most people would never even think of. At first glance, this symptom might seem to have no connection at all to vascular health, but it's actually a clue that experts have focused on for years, and it's quite valuable. Number 5, yellowish deposits around the eyelids. This symptom is a little different from the others because it doesn't cause any pain or discomfort directly. It's more of a visual sign. Small, yellowish, slightly raised patches can develop over time in the inner corners of the eyelids. In medicine, this is called Xanthelasma, and it's linked to cholesterol building up under the skin. Some research suggests there may be a connection between high cholesterol levels and an increased risk of hardening of the arteries. Because these patches are painless and usually develop slowly, most people see them as just a cosmetic issue and ignore them. The skin is actually an organ that can sometimes offer unspoken clues about the body's internal balance. When changes like this are noticed around the eyes, it can be helpful to consult a healthcare professional and get your cholesterol levels checked. This doesn't mean a definite diagnosis, but it can help us understand one more of the quiet signals the body sends out. Interestingly, these kinds of patches don't always show up in people with high cholesterol. In some people, they appear even when cholesterol levels are within a normal range, because genetic factors can also play a role here. Even so, research shows that some people with this symptom may have a higher than average risk of developing hardened arteries. For this reason, anyone who notices a change like this around their eyes is encouraged to get a comprehensive blood test to understand the underlying cause, rather than just looking for a cosmetic fix. Number 6. Unexplained fatigue. If you constantly feel tired even though you're getting enough sleep, and there's no clear reason for it, this is another symptom worth paying attention to. When blood flow to the heart decreases, the heart muscle may need to work harder, and this can lead to a general feeling of exhaustion. Unlike ordinary tiredness, this kind of fatigue may not fully go away with rest, and it can persist even later in the day. What makes this symptom tricky is that it can be confused with many different causes. Stress, sleep patterns, eating habits, or simply getting older are usually the first things that come to mind. But when fatigue becomes persistent and starts to noticeably affect daily activities, it could be a sign that the body is trying to send a deeper message. In these cases, keeping track of when the fatigue started and under what circumstances it gets worse can provide valuable information for a conversation with a healthcare professional. Patricia, a 58-year-old accountant, had noticed for months that she just didn't feel as energetic as she used to. She struggled to get up in the mornings, and by the afternoons she felt so exhausted her eyes would practically be closing at her desk. She changed her sleep schedule, drank more coffee, and even went on vacation, but the fatigue never went away. When she brought this up with her doctor during her annual checkup, further evaluation revealed that her heart was working harder than normal. Patricia's story is a reminder that even the most ordinary-seeming symptoms should be taken seriously when they persist. Another feature that sets this kind of fatigue apart from others is a noticeable drop in a person's overall stamina. For example, someone who used to easily get through their daily tasks might start needing more frequent breaks and more effort to do the same things. This change usually happens so slowly that the person themselves may have trouble noticing it. Often, it's the person's family or close circle who notices the change first. Because of this, gently sharing any lasting changes you notice in a loved one's energy levels can be a valuable step toward early awareness. Number 7. Erectile difficulties in men. At first glance, this symptom might seem unrelated to heart health, but research shows that erectile difficulties can sometimes be connected to vascular health. The blood vessels leading to the penis are quite thin compared to other arteries in the body. Because of this, when a general process of arterial hardening begins, these thin blood vessels can be affected before the others. Some experts consider this one of the body's early warning systems, because symptoms can show up here before they're noticed in larger blood vessels. Frank, who is 55 years old, initially accepted this kind of change as a natural part of aging when he first noticed it. But during a routine checkup, his doctor told him that this symptom could be connected to heart and vascular health, and that it needed to be evaluated together. This kind of approach can allow clues that are noticed early on to be addressed before bigger problems develop. Some healthcare professionals describe this symptom as a kind of early warning window, because narrowing in the small blood vessels leading to the penis can be noticed years before a similar process develops in the larger arteries leading to the heart. Of course, this doesn't mean every man who experiences this symptom will develop hardened arteries. Many other factors such as stress, sleep quality, or hormonal changes can create a similar effect. Still, it's recommended that this symptom, especially when it occurs alongside other risk factors, not be ignored and that it be discussed openly with a doctor. Being hesitant about this topic can cause many men to miss an early signal. Number 8. Irregular heartbeat and sudden dizziness. This is the symptom we mentioned at the beginning of the video, the one that many people attribute to a completely different cause. An occasional feeling of heart palpitations, irregularity, or sudden dizziness is often blamed on stress, caffeine, or lack of sleep. But when blood flow to the heart isn't sufficient, the heart muscle can also become electrically irregular, which can lead to rhythm disturbances. Some people describe this as a slight fluttering in the chest, while others describe it as suddenly having their vision go dark or losing their balance. Dorothy, who is 81 years old, had noticed a few times that she suddenly felt dizzy while standing in her kitchen and lost her balance for a few seconds. She had attributed these moments to low blood pressure or fatigue and hadn't taken them seriously for a long time. When she went to see a doctor with her family, she learned that the slight irregularities in her heart rhythm might be connected to narrowing in her blood vessels. What sets this symptom apart from the others is that it sometimes lasts only a very short time, and the person feels normal again almost immediately afterward. That's exactly why, when repeated dizziness or an irregular heartbeat is noticed, it's important to pay attention to whether there's a pattern, rather than treating it as a one-time occurrence. Part of what makes this symptom particularly noteworthy is that the heart's electrical system is closely connected to how well the heart muscle receives oxygen. When part of the heart muscle doesn't get enough blood, the electrical signals in that area can become irregular, which can cause the heartbeat to fall out of its normal rhythm. Some people describe this as a slight flutter in the throat or chest, while others feel nothing at all except a sudden dizzy spell or a brief loss of balance. Even though this symptom can be hard to notice, if it happens on a regular basis, it definitely calls for a cardiology evaluation. The 8 symptoms we've shared so far don't add up to a definite diagnosis on their own. The body usually sends complicated signals, and most of these signals can be linked to many different causes. But when several of these symptoms show up at the same time or repeat over and over, that can be a good reason to talk to a healthcare professional. Research on vascular health shows that changes noticed early on can help prevent bigger problems down the road, which is exactly why paying attention to these kinds of quiet symptoms is so valuable. The process of arterial hardening usually moves forward quietly over the course of decades, and for many people, the first noticeable sign is the result of years of buildup. This is exactly why early awareness matters so much. Because this process develops so slowly, small changes noticed early on can create opportunities that make a big difference over time. Regular health checkups, blood tests, and taking the changes you notice in your body seriously are among the most powerful tools you have throughout this long process. Remember, no single symptom is a verdict on its own. What matters is being able to notice these symptoms and share them with the right person at the right time. There are also some common factors that affect how quickly this process moves, and understanding them can help make sense of the bigger picture behind these symptoms. Smoking is one of the leading factors that wears down the artery walls over time and can speed up buildup. Uncontrolled high blood pressure puts constant extra strain on the artery walls, which can make it easier for fatty deposits to take hold. High cholesterol levels are the main source of the substances that build up in the artery walls, while uncontrolled blood sugar can damage the inner lining of the arteries and speed up the process. A sedentary lifestyle, poor eating habits, and a family history of early heart disease are among the other factors that can increase the likelihood of these 8 symptoms appearing. None of these factors alone guarantees a particular outcome, but when more than one is present together, it can point to a situation that deserves careful attention. A natural question that might come to mind at this point is how often these things should be checked. Most healthcare professionals recommend that middle-aged and older adults, especially those with a family history of heart disease, get their blood pressure, cholesterol, and blood sugar checked at regular intervals. These kinds of routine checkups can offer valuable information about vascular health even before the symptoms we've described show up. In other words, rather than waiting for symptoms to appear, taking a preventive approach can be a much safer path in the long run. To quickly recap the 8 symptoms we talked about today: pressure in the chest, shortness of breath, leg pain while walking, persistent coldness in the hands and feet, yellowish deposits around the eyes, unexplained fatigue, erectile difficulties, and an irregular heartbeat accompanied by dizziness. What these symptoms have in common is that they're often quiet and can easily be attributed to other causes. That's why getting to know your body, noticing small changes, and consulting a specialist when needed can be one of the most valuable steps you take for your health in the long run. Have you noticed any of these symptoms in yourself or someone you love? Sharing your experiences or thoughts in the comments could be helpful for others watching this video too. If you found this information valuable, sharing this video with your loved ones might just help someone notice these quiet symptoms. And if you don't want to miss more content like this on health awareness, don't forget to subscribe to our channel. See you in the next video and take care of yourself.